The co-host of this event, Honorable Dr. Abdul Momen, Bangladeshi Minister of Foreign Affairs, Honorable Vincent Biruta, Rwanda Minister of Foreign Affairs, Honorable Patricia, Scotland QC, Secretary General of the Commonwealth, Dr. Tedros, Director General of the WHO, honorable dignitaries, esteemed advocates, distinguished guests, good evening. Thank you all for joining us for this crucial event. The timing couldn't be more appropriate. We are gathered under the reality that as we speak, according to the WHO, 1/8 of the people we know, 1/8 of the people that we love is affected by mental health problems. If you allow me, esteemed guests, I would like to address the elephant in the room, as none of us is strange to the health crisis that the world is currently straining to overcome. There are events that take a toll on the mental well-being of entire populations, and unfortunately, Rwandans are all too well placed to know this. Our history is not only marred by the trauma of loss and undeniably of dehumanization, our history is also defined by the monumental effort of overcoming, following unimaginable collective psychological, physical, and emotional suffering. Dear guests, the world has lost 6 million people to COVID-19. Millions of families have been ravaged by premature death, and billions of people have suffered the COVID-19's financial and social strains. And the bitterness of the COVID-19 wake-up call may long remain, ladies and gentlemen. But the prevalence and rapid increase of poor mental health among our children, our neighbors, our friends, our fellow Commonwealth citizens must be done with. We must act, and this no later than the day following yesterday. It goes without saying, ladies and gentlemen, that mental health transcends the health domain. Poor mental health breaks down our communities by disrupting the wellness of families, poisoning our socioeconomic development. Presently, poor mental health costs the world economy an estimated $2.5 trillion every year. This hemorrhage of resources, this costly human tragedy makes one thing clear. Mental health is the bedrock upon which the welfare of our communities lies. We cannot allow this foundation to crack without us joining forces to solder it. Honorable guests, allow me to make the case for substantial resource attribution to the protection and support of mental health from the lens of a country that has seen firsthand its importance in survival. Over the last decade, Rwanda has strived to implement homegrown solutions by our citizens, for our citizens in mental health and beyond. Over the last, Imbuto Foundation, in collaboration with the Rwandan Ministry of Health and strong partners, recently launched the Bahoneza mental health program in Rwanda. Bahoneza tends to the mental health of Rwandans, very first day on earth, by ensuring the holistic wellness of the mother. Committed to actualizing a brighter future, Bahoneza defends the health of Rwandans throughout the life, and indeed, the birthing life. Ladies and gentlemen, the time is now. We need and must invest more financial resources in mental health research, prevention, skills, training, and treatment. We need and must eradicate mental illness stigma and develop a global culture of tolerance and self-accountability. We need and must deploy effective collaboration between mental health experts from public and private sectors, from state and non-governmental agencies across the Commonwealth to build resilient structures of mental health support. I thank you for being here and to define the way forward and improving mental health in Commonwealth member states. There is no health without mental health. There is no development without mental health. There is no brightness in our shared future without mental health. And ladies and gentlemen, there is no Commonwealth without common mental health. Thank you.